Hi, my name's Olivia. I'm going to be doing a peer review over the head and neck assessment done by Shelby Sherman. First of all, I would like to mention how I liked how you categorized everything, like all of the subjective interview and general survey data that you got. You put it all in the beginning, made it really easy to listen and follow. I also liked the 4-word test that you used in reference to helping to see if patients have an intact recent memory. Car, red, cookie, trumpet. I know I wouldn't be able to remember those even if I did have a good memory. I did want to mention when you were palpating your patient's scalp, don't forget to wear gloves because you never know what you're going to find. And I will also mention that you did say that you were palpating the lymph nodes, but you didn't mention the names of them, and then you forgot your pre-auricle and your posterior auricle and your occipital all the way in the back. For the sinuses, you mentioned that they would feel like you wanted them to note if they felt any pressure. Don't forget they will feel a little bit of pressure because you are pressing on the skin. You did a really good eye exam, but don't forget to mention the direct and consensual pupillary response when using the pen light. And I didn't notice if you mentioned any ptosis or lid lag when you were doing the cardinal gazes. Does the lid lag, or does it twitch? Does it have any nystagmus? You looked at the nose, but I don't think I heard you mention about the septum. You did a really good oral exam. You mentioned the teeth and the lips and the oral mucosa. You didn't mention where the tonsils stood when you did cranial nerve 10. A good practice that I do want to mention is when you do the carotid, when you are going to auscultate the carotids, you should hold your breath while you're telling your patient to hold their breath, just so you know when they're going to need to take a breath. You did have your patient swallow, but you didn't mention anything about the thyroid or the trachea. I will note that you did have some really good range of motion exercises. And let's see, you checked the capillary refills, but you didn't mention the condition of the nails. You may have, I may have missed it. And then 2 tests that I noticed that you didn't do were the finger to nose test and the heel to the tibia test. Just some things to be aware of. And my question for you would be, when looking in the ears, what tool would you use? What's it called? And what are you going to be looking for? Have a good day.